I'm Kim, and you are tuned into Kim E, the Diabetes MP. This is the Patient Corner. It's a segment that I created for those who have diabetes or those who have loved ones who have diabetes who want to grow in their knowledge over the chronic illness. Now, for the month of March is when I am recording this, I am covering diabetic complications, and I'm going over them little bit by little bit. I'm going to hit them one by one. I've already given a brief overview over complications, as well as gone over the complication of peripheral artery disease. We also know that as PAD. And if you're interested in viewing those videos, I'll link them in the description box. But today we're going to talk about neuropathy. So if you would like to learn more about neuropathy, diabetic neuropathy, stay tuned. We're going to get into it. So what is diabetic neuropathy? Now, it is a very common condition that can arise if you have had diabetes for a long, extended time, or if your diabetic diagnosis is not under control. In most cases, it's a mild neuropathy. A lot of times the feeling that you may feel is maybe feeling like you have socks on your feet when you really don't have socks on, having gloves on your hands when you really don't have gloves on. It's almost like you have another layer. You feel like numbness or tingling, pins and needles, legs, your leg pain, shooting, stabbing, maybe a little bit of burning sensation in your extremities. So the reason why you are feeling these types of sensations is because there is nerve damage going on. Basically, diabetes affects your nerves, the nerve endings, and there's a little bit of damage going on there. Now, typically, it's not a curable condition. Really, what we're looking for is to stop the progression. To a certain degree, most people are going to have a little bit of neuropathy, and you can even have neuropathy even if you don't have diabetes. But because we are talking about diabetes, of course, we're going to be talking about diabetic neuropathy. But typically, what we're looking for is to stop the progression of it, okay? Now, left unaddressed, you can, if neuropathy progresses, you can lose feeling in your feet. And you can only imagine the problem that would pose. If you're unable to feel your feet, if you were to clip your foot, nick your foot, cut yourself, you wouldn't know that you had a cut or a nick if you can't feel your feet. And then you wouldn't be able to tend to it. Now, as a diabetic, you may know that your healing process is slowed down. So if you do nick yourself, your wounds will not heal as quickly as the person who doesn't have diabetes. Now, this could lead to infection, which could ultimately lead to amputations. And so this is why we are very adamant about stopping the progression of neuropathy. Now, what is your treatment and follow-up? Good glycemic control, making sure that your diabetes is under control. And how can you do that? Now, you're going to hear a common theme that you're going to hear from me. I'm going to be like a parrot, just keeping on echoing myself, but good lifestyle modifications. We can start there. Making sure that you're active, that you're allowing yourself to have exercise, the proper amount of exercise, that you're committing to a good, well-balanced diet. And if you need a little help with that, I'll link some videos in the description box that I have made and have referenced that you can view after this video, but we'll start there, okay? Also, making sure that you're going into your primary doctor regularly. Whatever schedule that your doctor has set up for you, you want to make sure that you're keeping to that, making sure that you're taking your medications as prescribed, okay? Also, your doctor may also prescribe you some pain medicine to lessen the pain so you can have a better quality of life. And in addition to the pain medications, your doctor may refer you to possibly a podiatrist, which is a foot doctor, maybe even a neurologist, a doctor who deals with the nerves, and that can help you help your neuropathy from progressing. May even refer you to a vascular doctor just to make sure that your circulation is well as well. So these are certain things that your doctor may do for your treatment and follow-up. All right, that's all I have for you. I hope this quick video was informative for you. I hope that you learned something from watching this video. And again, if you're not already subscribed, go ahead and ding that notification bell and subscribe for me so you won't miss an upload. Like I said earlier at the beginning of this video, I am doing complications. So I'm going to be coming out with some more individual complications, common complications that can arise with diabetes. Again, you have been sitting here with Kim E, the Diabetes NP. This is the Patient Corner. I'll catch you next time. Bye.